Good morning, everybody. Nice to be with you this morning for this webinar called Purely Cosmetic, the Perplexing Issues in Reopening Aesthetic and Wellness Practices in the Time of COVID-19. I'm looking forward to going over the issues here and also happy to take questions about this topic. As we've been talking generally about the issues in opening healthcare businesses, healthcare organizations, a number of specific challenges have come up for aesthetic providers, wellness providers, and a whole broader set that I'll talk about today. And the goal of today's webinar was to delve a little deeper into those issues and make some recommendations. So I want to first thank our sponsor today. We're grateful to Elevate CBD Cosmetics, which has been a client of Nelson Hardiman and is a sponsor of today's webinar. Among other products, Elevate has been distributing a CBD hand sanitizer that has been a big hit with our team, and we want to invite anybody who is interested today to share a code available through July for Elevate CBD Cosmetics. I also want to thank and provide as background some of the work that I'll share today came about because of an invitation to join the Los Angeles Aesthetic and Reconstructive COVID-19 Task Force, which was a group of plastic surgeons, reconstructive surgeons, and dermatologists who worked hard to develop standards for the Southern California community. I was grateful to participate in that, and that handbook has a lot of useful information, not only for physician practices, but also for med spas. And if anyone is interested, we're happy to provide a copy of it. You can email us at info@nelsonhardiman.com. So I just wanted to open this webinar today with a quote that really caught my attention because this has been a polarizing issue. On one side, we have the pressure to reopen healthcare for patient access, for economic purposes, for behavioral health purposes, which I want to talk about today. And on the other side, we have an extreme concern. On April 30, when the city of Beverly Hills City Council lifted a moratorium to signal that it was permissible to perform not only elective surgeries, but cosmetic work, one of the dissenting city council members, John Mirisch, the only dissenting city council member, made this quote, "In the middle of a pandemic, nobody needs Botox." To me, that's just kind of an obvious sort of thing. And while it may be obvious to Mr. Mirisch, it is not at all obvious to many people. It's certainly not obvious to me as an attorney working with practices across a whole spectrum of issues. And in fact, it has been a significant challenge and in some ways a disturbing facet of the crisis that there has not been an urgency to consider how to provide access safely, and instead a continued desire to keep the practices, aesthetic practices, shuttered. So just to give you a snapshot of where we are as a country, 38 states have already reopened all non-essential, I'll talk more about that word, but non-essential elective care, including aesthetic care, including all forms of preventive and wellness care. That started in late April and has continued through this week. And I listed the 38 states that have done that. There are 2 states, by the way, that never suspended in the first place, Idaho and Wisconsin. And there are 10 states, of which California is one, that are still imposing restrictions that have been confusing and limiting for a whole series of practices that are deemed elective, non-essential, aesthetic, and other. And the goal of today's webinar was really to address the ways in which there are unique issues confronting these practices, partly from the regulations, partly from the confusion of government statements and how to deal with those, and partly from an emerging facet that we're seeing in the pandemic of what I have termed coronavirus bullies, which I'll talk more about, people who are not happy that certain kinds of practices are open. And the goal today was to sort of think about what do you need to understand as an aesthetic or wellness provider? What do you need to know? What do you need to be paying attention to and to strategize if you are interested in reopening? I also want to say at the beginning of the webinar that a number of providers have told me that they have reservations and are deliberately making the decision to close. And that, of course, is a valid choice. Really, a lot of the thinking today is for people who are thinking about how to reopen and not for people who are comfortable remaining shuttered. So the topics I wanted to cover are sort of how to understand all of the different levels of government pronouncements, how to think about them, where to think about where aesthetic and wellness practices stand today in California, to talk a little bit about the new safety protocols that need to be in place, how to message and communicate both internally with your staff, with public, with patients, how to prepare for this phenomenon of people who are very unhappy that aesthetic and other kinds of non-essential practices are reopening. And then I'll definitely try to leave some time at the end for questions. I do not have the chat bar up. I'm going to confess that I'm going to try to get it up so that I can see questions as they come. I think I just did it. Okay, good. So I don't see any questions right now, but if people have questions, feel free to put them in the chat and we'll either address them in real time or at the end. Okay. So I wanted to, first of all, we called the webinar, we talked about aesthetic and wellness providers. I wanted to note that there's really a whole bunch of healthcare providers who are captured by these issues, right? Not just plastic surgeons and cosmetic dermatologists and med spas, but a whole series of, there's a lot of interesting issues around massage and other therapeutic body work, IV nutrition, anti-aging and regenerative practices, and things like hair transplant, laser skin, hair removal, teeth whitening, things that affect dentistry, a whole series of practices that are being questioned in this time in these various states. I want to say, just as a necessary disclaimer, this is a educational presentation today, not intended to be legal advice by itself, and it's always important to talk about these issues with a lawyer, and the rules are very much in flux. All right, so let's start with the first topic of how to understand all the government pronouncements. Part of what's been really confusing is that we have 3 levels or 4 levels of government speaking to us throughout this crisis. We have the federal government through the Center for Disease Control and the Department of Health and Human Services through the White House, offering lots of statements about what is supposed to be happening. We have the state of California and other state governors issuing guidance, state agencies. And then at the local level, we have both counties and cities offering guidance. So in general, when we're talking generally about the Center for Disease Control and the White House and pronouncements from Washington, the overwhelming majority of statements from Washington are not binding. They are recommendations. They are clearly intended to put pressure on the states to move in certain directions. But generally they are not binding. It is important to note that our belief is that the guidance being put out by the Center for Disease Control, because it is national, is likely to be the de facto standard of care for what you should be doing. So we think it's important to consult the CDC standards and to consider them a kind of best practices, but they're not formally binding. The one place where of course federal law is binding is with regard to federal laws like HIPAA, if you're participating in Medicare, which I'm not going to talk about today, but obviously there have been a whole series of pronouncements that are binding. But when we're talking about CDC guidance on reopening, nothing is binding at a federal level because healthcare is regulated at the state level, right? Any practice that anybody who's on the call or any healthcare practice that involves a licensed professional, whether it's a physician, a physical therapist, a chiropractor, is inherently being licensed and regulated at the state level. So the state is formally the body that has authority and ultimate control because the states are supreme with respect to cities and counties. But the state is really not devoting any enforcement resources. And in California, and I'll talk about this a little bit more on the next slide, has specifically delegated the authority to the counties, and I'll talk about that. And cities, of course, have the ability within the counties to pass ordinances. I also note here just that a lot of the actual enforcement on the ground is typically by city attorneys, what we're seeing, by the local law enforcement trying to understand the public health guidance from the local and state level. And finally, one recurrent theme on this webinar is that what we see consistently in federal, state, and local law is that the state is really trying hard at all levels. The government is trying hard not to impinge on the discretion of health professionals to decide when care is medically necessary, medically appropriate, and how to decide what needs to be treated. We are getting broad guidelines. At one point we had orders in place only to do emergency work. Then there was some loosening to do work that was urgent, work that is essential, and we keep getting broader and broader. But really, at the end of the day, it is for the health professionals to decide what is medically appropriate, not for the government to opine on specific procedures within a licensed healthcare setting. Here in California, the delegation from the state to the counties is referred to as the Regional Variance Plan. And the idea is that the state is asking the counties to measure how the epidemiological, say that a couple times fast, stability of the virus spread is going, and generally to see less than one case per 10,000 over the 14 days, to see a flattening and reduction of the viral spread, increased testing capacity and containment, and some other criteria that the state has imposed to really say to the counties, we want you to be looking at how it's going in your county and to open up. What's interesting in California, by the way, is that some of the rules we're talking about, we haven't seen significant variance on things like massage or on particular kinds of aesthetic work, but the authority is there based on how the state has proceeded to date. I wanted to go through actually 4 different stages of orders just to understand the specifics of what the state has said. So on March 19th, 2020, the state, Governor Newsom issued the stay-at-home order, which was also propagated at the county level as well. And that order basically ordered a cessation to business activity, but exempted healthcare as an essential critical services sector. Within that, however, there was a notice of suspending elective care, and there was a reference to this phrase that has troubled me, of purely cosmetic. That's where the quote, that's the title for this webinar, came out. So there was this idea that certain essential critical healthcare had to continue, but certain presumably non-essential healthcare was not supposed to continue. Elective services were supposed to be suspended. That ended on May 8th in California. That was actually much later than in some other states, which is when the stage 2, the multi-stage roadmap, which I'll talk about on a future slide, was released. And the idea was that that was the date that there was a suggestion that it was ready. It was time for California to reopen elective procedures. But it was very clear when this guidance was given that what the state had in mind by elective procedures was really things like delayed heart surgeries and other kind of serious surgeries that didn't need to be done on an emergent basis, but still were, much more of the conventional medical procedures. There was a quote in the specific order on May 8th that non-essential medical care like eye exams, teeth cleaning, and elective procedures should still be canceled or rescheduled. There was no guidance, by the way, at the state level or at the county level, no criteria on what was non-essential. But as you can see from the examples that are being used, talking about things like teeth cleaning, we are still, this was far from a blessing to reopen aesthetic care. At the same time, it was confusing because there was references to things being non-essential, but not a definition of what non-essential meant. The next guidance that we had in the state of California was on April 22, when the suggestion became a reality and elective procedures were formally encouraged to be resumed, subject to not overwhelming hospitals or overburdening PPE needs. But there was a push to encourage, again, elective and key preventive services. But again, here too, we saw the government really focusing on things like colonoscopies and not what we're talking about by aesthetic and wellness kind of services, although a colonoscopy is by definition a preventive service to try and screen for potential colon cancer. The next move we saw was on April 26th, where we saw a state's guidance focusing on resuming elective and non-urgent procedures in physician offices and dentist offices. And that was the last pronouncement that we formally have at the state level. To date, there has still been no clear guidance and no follow-up to that original prohibition on purely cosmetic and non-essential services. There has been this specific reference to resuming preventive and non-urgent care, sort of regular care, but no statement on what purely cosmetic this apparent suspension is actually referring to. So I'm going to get into that a little bit more in our next section, but I wanted to just say right here, in terms of thinking about how to analyze these issues, the analysis it needs to be careful. There is a lot of what we're seeing is both in the media and even from some attorneys and observers is a sloppiness in understanding what is prohibited. For example, I'm going to talk more on this webinar about whether we should really understand there to be continuing prohibitions on any kind of medical care. And just to not keep you in suspense, my view is that we should not be assuming that there are suspensions of medical procedures, notwithstanding the fact that the state hasn't cleared up the statement. And the reason why is that I think the critical process that every provider needs to go through is to ask the question, is there any clear and specifically applicable state directive limiting the reopening of a particular service? Is there a specifically applicable clear directive at a local county or city level? You know, are there particular services that are specifically limited by the state or local government? And then I think it's also important to ask, to consider the broader categories of the business. One of the interesting phenomenon is that we have certain businesses, and I'll take two examples. In the med spa example, you'll have businesses that are medical in structure and providing medical care under the oversight of doctors, care being rendered by doctors or by non-physician professionals like PAs and nurse practitioners. And you also have care being rendered by estheticians who are regulated by the Department of Barbering and Cosmetology that are in a more purely cosmetic category and with no medical authorization, the definition of being an esthetician is that your care is cosmetic and not medical. So we have businesses that cross over that category line. Another example, which I'll talk about today, has been in the area of massage. We have specific statements about massage being a prohibited service, and yet we have a lot of massage being offered in the context of businesses that are medically overseen, that include things like physical therapy, chiropractic, and have physician oversight. So it's interesting to think about the category and whether there are parts of the business that are prohibited, parts of the business that are authorized. And what we're seeing is a lot of confusion. Hopefully we'll resolve it today. And again, I'm open to taking questions on this webinar about specific services. And then asking the question if any particular services should be delayed. Are there places where physicians or other health professionals should be exercising discretion in deciding what to reopen? All right, so I want to talk about where aesthetic and wellness practices stand today. And I apologize for any non-Californians. This is going to be California centric, but happy to talk about other states as well. We were looking at some issues in other states for a handful of providers. So California has announced this 5-stage risk-based reopening. I left off stage 4 and 5 because those relate to really to things that aren't applicable today, large gatherings. We are right now really in the continued rollout of phase 2. And as I mentioned a couple minutes ago, you know, phase 1 had this limitation to essential healthcare and this suspension or moratorium on elective care that was lifted, as I mentioned, in May, and this lingering statement about purely cosmetic care. What we've seen in phase 2, which is generally intended to open lower risk businesses, has been a clear set of permission and guidance to open elective procedures to allow preventive and wellness care and subject to new safety requirements. What we're seeing still be clearly prohibited, and I put question marks here because this is really what I want to talk about today, is there's this confusion about whether there are some forms of non-essential healthcare still being delayed and whether there's some purely cosmetic work that should still be delayed. There are clearly some specific categories that are not intended to be reopened, and those include things like tattoo, gyms and fitness studios. I'm going to talk specifically about massage because here we're talking about massage where there is no physical therapy or physician or chiropractic connection, where it's just a pure kind of retail massage. I would mention specific brands, but I don't want to get in trouble with any clients. I'll pick on a non-client. Burke Williams, for example, would be a classic massage without any kind of healthcare overlay. And nail salons are another category of purely cosmetic businesses that are specifically ordered to be shuttered. So again, the key questions that need to be asked are, is your business medical in nature? Is it under the oversight of a physician or some other health professional, nurses, licensed nurses, chiropractors, physical therapists? If some of the services are not medical, do they involve a wellness or preventive purpose where they are still a healthcare service in nature or medically appropriate service? And has the responsible medical professional made any kind of determination in their discretion that the service is medically necessary, medically appropriate, or beneficial to a patient? And here I want to note that there is a lot of confusion. There's a lot of literature addressing the nature of some services that appear to be for a partially cosmetic purpose, also addressing underlying emotional and mental health needs in terms of reducing stress, reducing pain, giving people self-confidence, making people feel better about themselves. We are not yet, we're only beginning to barely scratch the surface on this question of how damaging and how difficult this time has been in terms of the stress disorders, the post-traumatic stress disorder, anxiety and depression that that the shutdown has imposed, that the isolation has imposed on the population. And I do think that it is absolutely appropriate for healthcare businesses to be thinking about the questions beyond just, is this service medically necessary and appropriate? What I mean to say here is that I think the discretion of the health professional, the physician, making choices can appropriately include this category, and can appropriately, that can be an issue for the discretion of the physician. It is not appropriate for cities or counties to be getting into whether particular procedures are appropriate or not appropriate in this time. And I've had conversations with city attorneys and found that there is a temptation on their part to address those issues. And frankly, I think there needs to be some pushback, not to get into specifics, but simply to say, we have a physician, we have a medical director, or we have some other health professional director who's making decisions about appropriateness, about patient safety, and about benefit to the patient. And that is within our discretion. I just want to note here a few ironies. So I mentioned massage. The standard, by the way, if you are somebody in the massage business, is that pure massage, kind of the Burke Williams or the gyms, leaving aside that the gyms are also shuttered, Equinox massage, are currently impermissible. But if you, in the absence of a health professional, which those businesses don't include, but if they are permissible, if performed under the oversight of a physician or chiropractor in the context of a preventative healthcare service. So there clearly is room for massage, but it's driven by the oversight of physicians or chiropractors. Similarly, I want to take issue with the term purely cosmetic, because the question is, in what sense is a procedure purely cosmetic if it must be performed under physician oversight or by a non-physician professional like a PA or an NP? By definition, that's not a purely cosmetic procedure. Under the law of California and other states, the only thing that's purely cosmetic is something that is strictly being performed by a person regulated by, in California, the Department of Barbering and Cosmetology. That would be a esthetician grade chemical peel, or a facial would be purely cosmetic. But I think the term is not applicable, not truly appropriate, and I do not think it was carefully thought out when it was included in state orders with respect to anything that's under medical oversight. And I raise here this question. I don't have an answer, but I pose it as a question. When do aesthetic procedures serve a medical purpose of addressing emotional pain and distress, addressing feelings of abnormality? There's a body of medical literature out there to support that as a clinical matter. And I don't think it's anything that needs to be resolved on the ground, but I think it is a place where it's appropriate for health professionals and physicians to be exercising their discretion and asserting their right to exercise that discretion. So I wanted to talk about what the risks are for businesses on a practical level. What we are seeing in general is that city attorneys are generally the people to whom complaints are being forwarded in Southern California, and they are the ones vetting complaints. They are the ones doing most of the outreach. In some cases, law enforcement are being dispatched to get more information, to find out what's going on, or to when businesses are not supposed to be open. That would be, for example, if a nail salon was open today, law enforcement might visit directly. And then what we're seeing is that there are warnings and instructions to close businesses that are not supposed to be open, and a reluctance to issue citations, right? I think that what we're seeing is that there's not a speed in trying to create problems and issue citations, civil citations. And our experience has been that we've had quite a number of conversations now in different cities and some outside of California with city attorneys, and we found that these issues are resolvable with dialogue. If you make clear the basis upon which you are reopening and the manner in which it's being undertaken in a thoughtful way. We have found, for the most part, city attorneys to be quite reasonable and open to discussion. In fact, in some cases, simply providing letters from health professionals, from lawyers, has resolved the matter without the need for further discussion. What we're seeing, by the way, is that we are not seeing any involvement by the medical board or by other professional licensing boards. This is, whether you reopen or not, is not an issue that they are paying any attention to from our observation. And we're not seeing any instances of any kind of criminal liability or misdemeanors being put in. I should note, there are a few product cases that have made headlines about egregious kind of fraudulent conduct, including a aesthetic practice that was sending out hydrochloroquine and sending information around the country. And that is, those are cases that have gone criminal, but we're not seeing any criminality or professional licensing risk for generally reopening. Okay, I just want to make sure I'm getting the Q&A. It doesn't look, oh, I see there's a question here. Question as to how businesses operating on demand or with at-home visits come into play. Okay, so that's actually, I'm really glad that this question came up. What we're seeing is that there has been a robust, from the beginning of this crisis, back from March 19th, businesses that were providing aesthetic, preventive wellness services in-home, including things like Botox, IV nutrition, or injectables, have been operating consistently throughout this crisis at home. There has been no state guidance to in any way limit that. There has been encouragement for services to be provided when they can by telehealth, but no prohibition on at-home visits. And we have seen no objections to at-home visits. And so I think there is a big opening for businesses that provide on-demand or at-home services to continue to operate. I think that has actually been one of the few bright spots of the otherwise shut down nature of wellness and aesthetic services for much of the last couple of months. So I think I will just click that I answered that. Okay. All right. So I wanted to move on to the topic of just briefly to talk about safety protocols. I want to leave us more time, but I'm really going to do these just fairly quickly, but I think it is useful to understand them. What we're seeing is that the key planning components for reopening involve there is a state requirement of doing a detailed risk assessment for your particular business, a site-specific protection plan. There are 5 key elements to safety protocols that we'll talk briefly about: just screening of staff and patients, protective personal equipment, cleaning, sterilization, quarantining, and logistics. I'm going to talk a little bit further about messaging, adapting to patient expectations. There's a whole set of other business issues that we've addressed on some other webinars, but these are some of the planning pieces that that should go into creating and documenting your safety protocols. Having good documentation is is an important thing in case you are asked to explain exactly what you're doing. There was a question, by the way, of what risks patients have by going to these entities at this time. There's absolutely no risk to a patient. We are not seeing any suggestion that law enforcement have any interest in taking action or citing patients for going to these businesses at these time. Obviously, I'm going to talk on one of the next slides about patients being asked to sign attestations that they don't have COVID-19, and signing consents to address some of the risk issues. By the way, the handbook that I mentioned has an example of a consent, and we have also customized consents for some clients. But there's no risk so patients are going to be asked to consent and acknowledge the risk that COVID-19 exposure is a risk that can be reduced but not eliminated, and to make to sign other disclaimers. But there's no other risk to a patient at this time. And I just want to note, thank you to Sean for noting that the Plastic Surgery Society has a consent for corona exposure, and questions of how you protect yourself from getting corona in offices and businesses. So that's a good resource to know about. And there's likewise some similar types of resources in the in that task force handbook that I mentioned. So lots of good places to get resources. All right, so just very quickly, some of the key elements of your safety protocols should be a screening protocol, right? A screening protocol with regard to staff is asking staff to engage in self-monitoring and then actively monitoring patients, right? We're seeing a lot of practices use a certification that patients either sign in advance or upon arrival, attesting to the fact that they're not experiencing symptoms. And really, whether these are asked live or whether these are asked on a form, the important thing is just to confirm that patients are not symptomatic and a real focus on, on avoiding that. Technically, we're seeing a best practice recommendation that patients have their temperature taken before commencing services. And their screening also includes how do you handle when there is some discovery of a risk, how to handle high risk exposures, medium risk and low risk. I'm not going to cover that in great detail, but basically when you get the screening information, the question is whether there's anything to do with it. If you're dealing with a medium or high risk situation, potentially considering not having somebody treated or sending an employee home, those are those questions. A whole set of distancing restrictions. These are very important, and there's a whole series of processes to reduce the flow of patients, to try and reduce opportunities for interaction, not having people wait on site before procedures, and a whole series of things to do about distancing. By the way, there was a question, and I'll talk more about this in the messaging section about should we make adjustments to our Google listing. I do have specific suggestions that I'll share in the next section of the webinar on how to communicate that you are open. It is appropriate, I think, to communicate that you're open, but it's also appropriate to communicate a whole series of things to address concerns from both the public, from a lot of the people who are worried about the fact that you're open, and also to signal that you're open the right way. There are a whole series of new standards around sterilization and cleaning, having a lot of access to sanitizer, to good hand hygiene, much more significant cleaning of surfaces and equipment, and giving a whole series of things to really reduce the risk of contact exposure. And finally, having a quarantine policy of not allowing staff who have had symptoms or have had a high risk exposure to somebody who was symptomatic, coughing directly on them, for example, really making sure that you're quarantining staff. There are considerations about doing this for people who have traveled on airplanes, and really making sure that you're trying to do what you can to reduce the risk of your staff exposing other staff members or your clients to COVID-19. There's an issue for dealing with staff, by the way, that's important to note. OSHA, the Occupational Safety and Health Administration, was one of the least attended to compliance topics for many healthcare businesses. This has not been, there were a whole series of workplace safety requirements that generally received little attention. That has been a major, major change of this crisis. Infection control and OSHA guidelines have now moved to the top of the list of compliance obligations. They've jumped past patient privacy and other kinds of critical concerns. And so there's a lot to do here. These are really about protecting your workforce, and they go to the kinds of controls that we've been talking about that are being imposed or recommended at the state level. But there's also a concern here to really paying close attention to what your workforce is asking about, and documenting that you are taking concerns seriously and making reasonable efforts to address claims. Sometimes you may have employees who are asking for things that are not, that are above and beyond and not reasonable. You may have employees asking about things that are legitimate. It's very important to document that you're taking these things seriously, and to avoid any suggestion of ignoring or retaliating against employees for raising these issues. I just wanted suggestions for some of the key documentation that we're seeing, that we recommend that practices keep on site. One is having some kind of summary risk assessment and protection plan that summarizes your safety protocols and how you are open, what you are doing. I think that's an important document to have. We are seeing, as I mentioned, a lot of practices have both staff and patients sign COVID certifications that they are not contagious or symptomatic, not had high risk exposures. We are having a staff acknowledgement that's a document that we've prepared, and we're happy to share that and suggest how that can be used. Informed consents for patients, which we've talked about. It's good to think about how to handle contact tracing if there are exposures. One thing that we are not recommending and we are not supportive of is any kind of advanced liability waiver. It's a fundamental principle of professional liability that you can't ask people in advance of treating them to waive liability, right? You are ultimately liable for treating people appropriately. You can ask them to acknowledge the risk that you simply can't eliminate the risk of COVID-19 exposure, but you can't ask them to waive every risk or to waive things in advance. So that you have to be careful about not signing a document that would be ineffective or even worse, unhelpful. By the way, there's a question here about why aren't employees getting COVID-19 testing? We are seeing, I do think that eventually we will see widespread testing. At the moment, there's no FDA approved tests available. The current tests that are being used are being fast-tracked by the FDA without approval under something called EUA or Emergency Use Authorization. That is a process where, unfortunately, we're not really sure how great these tests are, and we're getting we're still continued reports of a high level of false positives, false negatives, and we don't really know, frankly, even what the testing means. We are not seeing there's two kinds of tests, right? We see a swab test, or some kind of test for immediate detection of whether somebody is infected or not. Those tests, we need those tests to come down in cost and to be available reliably and rapidly, because that's a test that only tells you for one moment in time what can be done. And then there's the question of rapid antibody testing. We are still waiting for the FDA to approve certain EUAs. I just had a call this morning with a telehealth company that is waiting on one of the rapid antibody tests out there is from a company called Scanwell. And we're waiting, and we're anticipating that hopefully the FDA will be releasing, giving an EUA and allowing that test to be done. But even then, we don't really know what having the antibodies means from an immunity standpoint. So I think we are going to see a shift to tests in the later part of the year. But at the moment, we're not seeing that as a required standard, certainly a good practice. So another question, just to answer at this point, somebody asked, should we send the consent on Corona prior to the day of the visit to be read and signed prior to entering the building? That is a good practice. We're seeing a lot of people have people sign these in advance. Obviously, if you're going to have somebody certified that they are not infected, they should not sign it a week in advance, but having people sign things the day before within one business day is a good practice, and it makes things go much faster. It gives patients plenty of time to read and ask questions. And so I definitely recommend that as a good practice. And it also means you have documentation as opposed to just asking the question on site. Just another quick question here. Sean, you've got lots of questions. Would the landlord be responsible for the janitorial staff that clean public restrooms and common areas and come to the suite spreading germs? How much is the landlord responsible for common areas on a daily basis, an entrance and medical building, protecting individual suites and offices, specifically if written notice is given to the landlord? This is a really good question. This is a difficult question to answer. It's very much in flux. It's not, landlords are claiming that they are expanding cleaning, but what we're generally seeing is most landlords are not giving extensive detail about the level of cleaning they're doing. And anecdotally, the reports that we're hearing is that nothing that the janitorial staff do would come close to the cleaning and sterilization standards that is being expected of businesses. So, it's interesting. The way that most commercial leases are written are very protective of landlords. And I think it's going to be difficult to impose liability on landlords. I suspect that is not going to be a fruitful effort. For the most part, we're still seeing so many fights with landlords about whether they are going to be required to abate rent, whether rent deferrals. I do not expect to see a significant move towards landlord liability for some of the intensive cleaning, but that just doesn't seem to be in the picture for the short term. I will come back to this question. I'm saving it for this. Okay, I was saving your question, Gordon Vasquez, for this current section, messaging in the time of Corona. I want to get to how do you message to the public, but I first want to just say a quick word. I think it's about how you communicate broadly. I think we are living in a time of rapid change, and this crisis has evolved significantly. Implicit in the way that I think about this crisis is that we went through an initial period that really ended at some point in April, where at least in Southern California, we avoided a surge and a overburdening of our hospital system, and a period where the epidemiological concerns were front and center. And we are slowly making this shift to a period where we're balancing epidemiological concerns against economic concerns and against behavioral concerns. And so, what we're seeing is that there are a lot of different responses to this crisis. Some people are extremely frustrated that things aren't reopening, and many people are at the opposite end of the spectrum, really terrified and anxious over the reopening. And you're going to see that within your workforce. You're going to see that in the public. And I think it's important to communicate in a way that's thoughtful about it. Internally, and with regard to your existing patients, I definitely think that a strategy of more engagement, more communication on these issues is useful. Providing lots of updates on your resources, alerts on your new protocols, additional education information to help people understand how they can be empowered to limit the spread and then limit exposure, and taking a person-centered approach to communicating with your staff, with your clients, your patients, on evolving needs and how things are going. That's just some broad guidance on communication. I think there was this question about, we're putting out, should we list our Google opening to say we are open? We are generally recommending that it is important to make clear that you are open, because what we're finding is that the public is not just assuming that many aesthetic or wellness businesses are open. The 5 points that I think are really critical to communicate in sharing that you're opening are making it clear that you're open, that you are operating under medical, physician, or health professional oversight, that you're operating in accordance with the public health directives, because it's important to really sort of diffuse this fear that so many practices are opening without regard or in defiance of orders. I think it's appropriate in many cases to make clear that if you are a business that has mixed services, that you're only offering either medically appropriate services or services that are that have been approved by the responsible health professional or physician. In some cases, deferring purely cosmetic services, which I made reference to before, like esthetician services, and I'm talking now in a retail, not in an in-home context, in terms of deferring those services, and making clear that you've adopted safety protocols. These are kind of important points that need to be communicated, and not just communicated once, but communicated repeatedly. So with regard to the question of adjusting a Google listing, it may not be appropriate to say all of that on a Google listing, and it's worth thinking about how much to communicate in different contexts, vis-a-vis websites, apps, signage, phone lines, and listings online. But I think you want to make it possible for people to see this, because one of the things I'm going to talk about next is that questions are coming not just from interested patients, but also we're seeing that staff are concerned about these issues, and we're also seeing that other members of the public and competitors are tracking this also. And it's important to put the information out there ultimately for the public health authorities and law enforcement, so that there are no questions that your reopening is legitimate. Okay, so we talked about adjusting to the crisis. I wanted to just talk about the specific questions around what you should do if you are actually reopened and questioned. And I think 2 pieces of that we are seeing to be of value in talking to city attorneys or law enforcement is either having a letter from the physician medical director or the responsible health professional explaining the reopening, explaining the decision to reopen and the continued operation under the principles that I had on the last slide. And in some cases, we have been actually issuing letters to letters that practices can have to keep on site to avoid questions. We're finding that may not be a necessary strategy for everybody, but if you are someone who is concerned that is getting complaints or worried about getting them, that is an effective strategy that we are finding. I wanted to just turn as a final topic before going to some of the questions that we have to what I'm calling the coronavirus bullying. And what I realized was there are some people out there who are either genuinely made crazy by the fear of coronavirus or are using it opportunistically. What we're seeing, what's evolved is that we're now seeing that there's a significant number of people who are confrontational. And I include, by the way, within this, people who are walking up to complete strangers and confronting them about their use of PPE, people who are making complaints and reports about activity by businesses, by neighbors, we're seeing people trolling on social media of businesses that are open and expressing their displeasure and trying to police the level of compliance with the COVID-19 guidance. What we're seeing is that, what I take this is as essentially a form of a behavioral health disorder, that people are so afraid by this crisis that they are trying to aggressively police other people's behavior. They're behaving in a much more angry and aggressive way, and they are being much more expressive about people making choices they don't like. So the question is, what do you do about it? And I wanted to just offer a few thoughts, some strategies. Number one, I think one of the things I've been trying to emphasize on this webinar is be ready for those conversations. Have explanatory materials available. Have documents, if you think letters are useful for your practice, have them ready and explain the basis for your reopening. I think it's very important to address the confusion over businesses that are operating under physician or health professional oversight, the difference between medical and non-medical services. And again, I don't think it's useful to get into the details of particular procedures. I don't think you want to be arguing with particular city attorneys about whether you are, injecting fillers, for example. But I do think it's appropriate what's appropriate is to emphasize you are making choices not just willy-nilly, but under physician discretion about medical appropriateness. I think it's important to respond and not be intimidated by the bullying. I think it is simply a facet of this moment in time. We are seeing some on social media trolling. We've had questions come up from several people, and it's important to be monitoring that and looking for, and simply just, I don't think it's worth engaging with people who come from that perspective. In fact, our advice is to be respectful of the people who, in good faith, continue to be nervous, because I think there's some part of the client base that may not come back for some time, and I think it's important to be respectful of those people while just not responding or engaging with the people who are being overly aggressive. And again, in some cases, we've recommended screening processes to distinguish between existing patients and who may be easier to schedule and new patients to avoid dealing with coronavirus bullies. So I want to take the last questions, and I have about, I was going to take the next 10 minutes or so if there are more questions. I see that I have a few to answer. Just a final sort of high level thought, that we're in a period of massive confusion over what the government orders actually say, coupled with this phenomenon of bullying by people who want the lockdown to continue more aggressively for epidemiological reasons, irrespective of the economic costs and behavioral health consequences. In our view, there is, under the current guidance, not only in California, but in a number of states, significant leeway for medical businesses to operate subject to understanding the rules, to careful planning, to clear communication, and to exercising physician discretion. And our experience is that the authorities are largely deferential and not interfering when that discretion is exercised appropriately and when communication has been clear. I just want to say I put my information up here, and we're glad to share these slides. If you'd like them, please email us at info@NelsonHardeman. And just a final thank you to our sponsor, Elevate CBD Cosmetics, and encourage people to support Elevate CBD, and grateful for sponsors for our programs. As we've said on past webinars, we are really happy to do what we can to put out more information that would be relevant and useful to the healthcare community, to different sectors. And we hope that this program today has been useful in that respect. Thank you so much, everybody.